You've tuned into The Break Room, a weekly conversation about how the city of St. Augustine works from those who do the work every day. Hosted by the City of St. Augustine's Communications Manager, Melissa Wissel, The Break Room offers a closer look at the city's programs and provides updates on current and upcoming projects. And now, your host for The Break Room, Melissa Wissel.
Welcome to The Break Room. Thanks for joining us. I'm Melissa Wissel, Communications Manager for the City of St. Augustine. The past several weeks, we have been addressing the local impacts of the coronavirus, and we've heard from our City Manager, John Regan, as well as St. Augustine Mayor Tracy Upchurch. And this week, I'd like to continue our conversations and share yet another perspective, and that is the perspective of our local public safety and first responder workforce. So I'd like to welcome to the Break Room, St. Augustine Fire Chief Carlos Aviles. Chief, welcome to the Break Room.
Oh, thank you so much. This is my first time here without Paul Williamson. So
thank you for coming.
I'm so glad to be here. I know Paul's listening. We miss you. I hope that you're enjoying your retirement.
Yeah, he couldn't have picked a better time.
Very true.
So thinking back to the times that we've been on the break room, and I was actually thinking about this as I was putting my notes together for our conversation today. In the past 2 years, you and I have been back to back as guests on the break room with Paul, talking about hurricane season.
Yeah.
Reminding people, get prepared, stock up on supplies, get your evacuation plan, get your household affairs in order, insurance up to date, all those hurricane season things, but we're not in hurricane season. We've got a major health crisis happening right now, and whether it is a hurricane or coronavirus, you are the emergency management coordinator for the city. You are a part of the emergency management team that spends a lot of time out at the EOC. That includes the county, St. Augustine Beach, our police departments, the sheriff's office. Let's talk about coronavirus, though, for a little bit. How are you guys holding up?
We're doing well.
Okay.
I mean, so this is a little bit new. It's very unprecedented. So we are adjusting to, I suppose, a new level of normal. Mm-hmm. It's not, I guess, unlike a hurricane in the sense of we saw the threat coming, began our preparation early and ahead of time, really started aggressive training and procurement of protective equipment, all the way back in late January, early February.
They're hard to come by now.
Yes, they are very, very hard to come by now. So I guess in those regards, the two things would be very similar.
Okay. In a hurricane, emergency management has sort of the lead on that. In this situation, this crisis, we have a different leadership or different decision matrix with health department, which is another new dynamic.
It is. So this is just, it's usually the EOC and all of our partner agencies, including the health department, working towards the common goal. So now the health department is sort of the lead agency within the county, and the EOC is really spun up to help support the health department in their mission.
And being in the EOC, you go out there, we don't have FP&L and solid waste and all of those teams of people. Because in this situation, everybody's really been asked, go home.
Correct.
Stay at home.
Yep. We've very, very restrictive access to the EOC. So on a given natural disaster, we may see as many as 200 to 300 people in there in a day working different shifts.
I've been in there.
And living, at the EOC. So no, you're not seeing that. There's a very extensive screening process now to get in. And if you're not directly supporting the role of the EOC, then you will not be allowed in the building.
And the EOC is the hotline number people call if they have concerns still. So we do still have resources out there. The phone number, since I've brought up a phone number, is 904-824-5550. How are you at the stations here locally in town? How is the fire department adapting, making changes, and nobody's gotten sick?
Well, let's knock on wood. No
okay,
one's gotten
sorry about
sick,
that.
Right? Yeah. So yes, we have. We've taken into account several safety measures. Some were very minor and easy to implement. Others took a little bit more coordination. Mm-hmm. But some of the things that we've done, we're doing medical screenings for all of our employees. They're having to ask, or they're being asked 6 different questions at the start of every shift, and then the midpoint of every shift. They're also having their temperatures taken. And so if any of those things show up as positive or become flagged, then those employees are being sent home. And we go through a different systematic process of determining whether they just need to go home until they're not symptomatic or whether it requires further testing. Very small things. I mean, we installed sanitation or hand sanitizing stations in all stations, like I said, back at the end of January. Stocked up on personal protective equipment. Really had to come up with a lot of new policies. So policies for personal protective equipment or PPE, and then determining what our burn rates were. So how often are we using gear? How fast are we going through it? How long do we, how often are we getting resupplied with items? So
is it cleanable? Is it stuff that can be recycled, reused?
Some of it is. Like we have like Tyvek suits that could be deconned and reused. Most of the stuff is one-time use, disposable.
Right, which is why they're hard to come by.
Right, exactly, because everyone needs it at the same time.
Right.
But some of the more interesting or aggressive things that we've done to sort of curb it, as we were anticipating the peak of this, we limited crew swaps.
Okay.
So just temporarily for a 30-day period. It's not uncommon for guys and gals to need shifts covered for them. And so it's a pretty easy process where one person just agrees to work for somebody else. So we've really put a halt to that. And then we have divided the force. And so the downtown station on Malaga Street houses an engine company and a ladder company. So the ladder company has 4 on there. The engine company has 3. So there were 7 firefighters on duty every day, plus 4 full-time administrative personnel.
In the station?
At the main station downtown. The island station has 3 personnel on it every day, so we didn't need to do anything there. So in an effort to reduce cross-contamination or the risk of having one person becoming infected and then potentially spreading the virus and needing to quarantine 2/3 of a shift.
That's a lot of people
It's a
down.
lot of people, right? Because the calls are still coming in. There are still emergencies that need to be run. So we reached out to one of our local partners at the Florida School for the Deaf and Blind, and they have just been phenomenal, right? I kind of explained what we wanted to do and said, do you have a dorm building that you're not using? And how would you feel about potentially housing some first responders on your campus and allowing us to set up a satellite station in the northern part of the city, which they were completely receptive to.
That's really cool.
So they have moved in. There was a text string that was going back and forth between the crews as we were kind of giving them notifications or heads up that changes would be coming. And the Florida School for the Deaf and Blind, their athletic mascot are the Dragons.
Oh, okay.
So somewhere in that conversation, the term Northside Dragons was adopted, which we
Nice.
we loved, right? The deaf and blind school folks really latched onto it, and so I think that there's a little bit of a sense of ownership there from all parties involved.
Absolutely.
And so, but it's just a really great example of really the emergency management system working the way that it's supposed to, right? We identify a need, reach out to local partners to see who could fill that mission and support it. And we're very fortunate to have the relationship that we have with the Florida School for the Deaf and Blind.
Excellent. You're listening to The Break Room if you're just now tuning in. I'm Melissa Wissel, Communications Manager for the City of St. Augustine, and today we have the pleasure of speaking with St. Augustine Fire Chief Carlos Aviles. Carlos, you were just talking about the satellite station, effectively, that you all have set up at the Florida School for the Deaf and the Blind. It's also an interesting trial run just in terms of logistics of any potential future expansion. You're able to run those calls for different parts of the city. How is that making any type of an impact or difference, or giving you something to look at?
It is definitely giving us a data set to look at, right? I'm a big analytics guy, so I like to dive into the numbers at the end of every year and really kind of keep up with trends and figure out. We just want to ensure that we're providing an adequate level of service, right? So this community has come to expect a very high level of service. So again, it's a very early data, but really right now, last year, that portion of the city saw an average response time of about 5 minutes and 35 seconds, which is
That's
still
fast.
really good.
That's really
right?
fast.
That's below the national average, which is awesome. But in a little over a week, that time is averaging sub 3:30 now.
Wow.
Which is awesome, right? So we're able to provide the same
it's
level.
Olympic.
Right.
It's Olympic.
I mean, it's a big, big improvement. So, somehow throughout all of this, we have figured out a way to ensure the safety of our personnel and first responders, and also enhance the service that we're providing, to the community in a portion of town that we really wanted to see these numbers improve in.
And I think that's something that we see you as our chief and in the fire service and the department is something that you have brought from the very beginning, is always looking for some innovative solutions, efficiency, improvement, really a cohesive effort. You all work really well with police department. This whole pandemic, epidemic, health crisis is not easy for anybody to get through. And even recently, you all have had 3 major fires, or I don't know if that's my word, major, but I know that they're fires. They're not a car on fire.
Right.
Any kind of fire is a fire, but can you speak to that? You guys are still running calls. So
we are still running calls. So overall, the call volume has dropped about 30%, which is significant. I mean, that's probably erasing easy, 10 years worth of increases. So it's that's helping things. We're running more calls that require us to have personal protective equipment naturally, and so we're slowly adjusting to that sort of being the new normal. But it's been a very busy few days. And then just from a tactics perspective, we're very mindful to be almost super aggressive right now. If we get a house fire in the middle of a day, a few months ago, the likelihood of that home being occupied slim to none, right?
Right, because they're at work.
People are at work.
Kids
are at school.
Mm-hmm.
So that was always something that you thought about. Now it's 24/7.
Everybody's home.
We're driving to that house fire, really thinking it's very likely that home is occupied right now.
And perhaps that's part of it. People are home, and so there are more opportunities for risk, shall we say, or not necessarily? Hard to say.
I don't know. I mean, it would be difficult to really guess. I mean, why it's happening. Like I said, I mean, the good news is that the overall call volume is down. Trauma's down. Lately the fires have been up, but that may just be coincidental. But I mean, you're right. So much of what we do is reliant upon those relationships that we have with our local partners. You mentioned our relationship with the police department. I won't pass up an opportunity to talk about how fantastic our working relationship is with St. Johns County Fire Rescue. Both agencies are just extremely supportive of each other. Myself and Chief Pravat, 100% just want to make the right decision that is going to impact public safety, whether it's a county resident or a city resident. We're all in this fight together. And, really right now we're finding out we're all in this fight together.
Right.
So it doesn't matter what your agency is or does. And, but I mean, we feel very blessed to have the support that we have from local private partners, and then the city staff and city leadership. So, Mr. Regan's been phenomenal throughout this whole thing. He's got a real deep science background, so this is maybe the perfect disaster for him to be sort of joined at the hip and helping us in those decision-making processes. So he's giving us some different perspective and really bringing a whole new approach to this that maybe we wouldn't have looked at otherwise.
Right. In all of this now, we will skirt the subject a little bit. We're running out of time, so we'll have to have you back when it really is hurricane season. But no joke, we do need to be mindful. Maybe now's a good time to start thinking about it. It's a little early.
It's always
hurricane.
a good time, right? We always say, I mean, you got to plan when they're blue skies. So, no, I mean, it really is. I think it's some 40 some odd days away right now.
Right.
So, yes, now would be the time to make sure everything is in order. If you're at home and looking for projects to tackle, that would be a very good one, right? Look at ways to harden your home, be prepared for what is coming. Last year we did have a named storm before the official start of the season.
Right.
The current models do predict that it would be a slightly elevated season this year, so we're above average in terms of number of named storms.
Somebody's putting us to a test.
I know.
But we can handle it, right?
No, we can handle anything. This community is very resilient.
That's
so
right.
I'm very confident in that. But yeah, no, this would be the time.
Okay.
Make sure that you have a plan in order, and that's what we're doing, right? Because we're,
Right.
as you mentioned before, we're in the business of constant improvements. If you're not finding a way to make the situation better, you're only getting worse. So, the fact that we're dealing with this current pandemic has not, we have not taken our eye off the ball of what is ahead of us still.
Good. And when things start to develop, of course, you and Chief Fox and City Manager, and of course, all of our information platforms, we're going to be putting that information out there. I want to thank you for coming by today. This was a great conversation. I will look forward to our next time. If we have to come back here before hurricane season, we'll be talking hurricane storms and talking about whatever kind of plans we've got in place for that. We're always planning. I want to thank anybody who is out there tuning in today. As we wrap up another edition of The Break Room, I hope we answered your questions. If we didn't, take a minute to drop an email to info@citysanog.com. Let me know if we missed anything or if there's someone you would like to hear from. We want to keep you informed about what's happening in and around the city, and most importantly, that you hear it here from the people doing the work and making it happen every day. Remember that in order to stay connected, you need to be connected. Like us and follow us on any of our social media platforms. Or on Facebook, Twitter, and Instagram @CitySanog. Thanks for tuning in. Until next time.
You've been listening to The Break Room, a weekly program about projects and programs offered by the City of St. Augustine. We hope you'll join us each week as host Melissa Wissel and her guests have a conversation that helps you better understand how our city works to meet the needs of our community. See you next time on The Break Room.